A week ago, verdict came to you from my living room while I was self-quarantined in Texas and Michael was skipping and scot-free in California. Today, the tables are turned. Now, Michael and the entire state of California are on lockdown. He's in effective quarantine with the rest of the Golden State. This is Verdict with Ted Cruz.
Welcome back to Verdict with Ted Cruz. I'm Michael Knowles, coming to you from lockdown as now, even since the last time we spoke, the 7th and 11th largest economies in the world have gone on lockdown, California and New York. Now, Senator, thank you very much for doing that cold open, because not only are you doing my job on the cold open, you're also doing the job of the booking producer. You have brought along one of your friends, Senator Barrasso from Wyoming, who has expertise not only as a senator, but also as a physician to help us try to understand this pandemic.
Well, John, welcome. John Barrasso, senator from Wyoming, but he's also Dr. Barrasso. And so he is wearing not only a senator hat as the number 3 Republican in leadership and head of the Republican conference, but also someone who's been a medical doctor for many decades now. And so welcome, John. Glad to have you.
Great to be here. And I'll tell you, this is such a popular show, certainly in Wyoming. Verdict, people turned it on every night during impeachment. But remember, 4 years ago, you were the choice of Wyoming. And we were big Trump territory now, but I'll tell you, you were the pick of the people of Wyoming who went to the Republican convention in 2016.
Well, John, thank you. I will say you're the second senator to join us on this podcast. The first was Lindsey. And Lindsey, in his typical understatement, walked in and said, "What in the hell is a podcast?"
Senator, cleaning up his language, I think.
I'll also point out, he looked at these gigantic microphones. He looked at this shag carpet out of the 1970s. And he said, if you guys are the number 1 podcast in the world, who the hell is number 2? Some guy in a park outside a van?
That's Lindsey.
So you've got a high bar to reach because Lindsey's blazed the trail.
Well, he is must-see TV. He's a high-wire act, and people are always waiting to see which side of the wire he's going to fall off of, but he's amazing.
Well, Senator Barrasso, I'm so glad you could join us today, because I know that typically senators are able to go home for the weekends. It looks like that will not be happening now. There are multiple bills that have been voted on. We're waiting on the next bill to come forward. I was wondering if maybe we could talk, as Senator Cruz, as you mentioned, from your viewpoint as a physician. So much of this is focused on getting more respirators produced, getting them out to hospitals. Just from the medical perspective, where do we stand right now?
Well, I'm happy to talk about all of those things, because you're right. I go home every weekend to Wyoming, was home last weekend, talked to a number of folks who are physicians, as I continue to do now by phone, but was there in a number of events around the state of Wyoming last weekend, and we have changed dramatically as America's economy, and America is essentially shut down, as has the world. And when you think about last weekend, we went from a day in Las Vegas where the one day they were going to close down the buffets to 2 days later, they closed down the entire town. So this is moving very quickly. And so it is as well medically. Talking to folks at home, I talked to the hospital administrator. I said, do you have enough respirators? Well, they have 18. Now, I've practiced medicine there since 1983, so 37 years. They've never used all of them at the same time. So by any stretch of the imagination, we have more than we need at our hospitals and around the state of Wyoming. But if this pandemic goes full-blown, as we're concerned about and what we're seeing in other places around the world, there may not be enough. But to just put it into perspective, and Ted and I were talking about this at lunch, if you take a look at England, the whole country, about 50 or 60 million people, they have 5,000 of these ventilators, breathing machines that you can hook people up to. We have 160,000. So for every one they have in England, we have 32. But we only have about 5 to 6 times the population that they have. So we are the most prepared country in the world to deal with this. Do we have enough? I hope so. But we may not. But if we don't, no one does. And that's the concern. And that's why we're working so much with social isolation and separation and keeping people distance, trying to do the proper things with hygiene, all in an effort to prevent more rapid spread and a prevention of the ongoing concern that we have about the capacity, not just with respirators, but what I hear when I talk to folks at home is, are there enough tests? Can we get people tested who have symptoms? And then are there enough personal protective equipment available?
So, John, let's unpack this a little bit. And you and I were discussing this over lunch. So the ventilators are these big machines, for those of us without MDs, the big machines that breathe for you if you're either in surgery or you've got severe respiratory problems.
In an intensive care unit.
In intensive care. And so the challenge is that you look at some of these countries, and I think Italy has seen it the worst, where we're reading stories out of Italy where they've run out of ventilators and they're sitting there with multiple patients in respiratory failure, and they're having to make triage decisions of this person gets a ventilator, we're going to save this person's life, and this person, we're not going to save this person's life.
And they're not sure if it actually is going to work to save that person's life because on average, some of these people are on these machines for 10 to 14 days. And at what point do you know? They've been there a week and you don't know which way it's going to turn. So one of these machines gets tied up a long time with a patient who is on the machine, which is why they're working so hard with medicines that are already available worldwide that may help shorten the amount of time that somebody would need to be on the machine. The president talked about that with a malaria medicine. There's some HIV/AIDS medicine, things that we think may be helpful. Also hepatitis medicine.
You were chief of staff at a hospital in Casper, Wyoming. You said they had 18 ventilators, and your whole time there, you never used all 18.
Right.
They were
Same
always...
time. Yes.
What happens if at that hospital 100 people show up with coronavirus and with severe symptoms? What happens then?
And so the next thing you do after those 18 is the machines that you can use in an operating room for anesthesia, if you put somebody to sleep. But that takes additional manpower, personnel that know how to use them. Anesthesiologists know how to use them as they do during a surgery. But that's not 14 days. Mm-hmm. So you'd have to have huge amount of resources, people and personal protective equipment to keep those people safe while taking care of the folks with coronavirus. And that's the big concern, is that we may overwhelm and tire out the staff as well. They're already working significant overtime hours. And if any of them get the disease, and some of them are, then they're taken out of the fight.
Right. Well, I know, Senator Cruz, you made a point of writing a letter about this. In terms of getting these machines, obviously, as Senator Barrasso says, we're in a much better position than other countries, but we could use more. You have suggested that the administration invoke the Defense Production Act. This is a law from 1950 that would turn our manufacturing capacity toward government ends, especially in times of war, times of a pandemic. You requested that the administration invoke this, and it looks like today they have.
Well, that's right. And so I wrote a letter this morning to the Secretary of Health and Human Services, Alex Azar, and I urged him to use the delegated authority from the president to direct the building of critical medical equipment, and in particular ventilators. I don't want to see us in a situation like horrifically they're seeing in Italy. I don't want to see doctors having to make a choice of who gets to live and who has to die because they don't have the equipment to save their lives. And you can't build a ventilator overnight. And if we wake up 2 weeks from now and instead of 11,000 cases, we've got 200,000 cases or 1 million cases, it might be too late then. And so I believe that the president, the administration ought to direct the manufacture of these ventilators and masks and other equipment that is needed. We ought to be directing it right now so that we can meet this crisis. This is, everyone recognizes this is a public health threat. We need to do everything on the front end to make sure we're not forced into an impossible situations on the back end.
And military opportunities to use the equipment there as well from the VA hospitals and other sources. So there's some additional capacity, but it can still get stretched to the limit.
And listen, you don't necessarily have to have the hospital in Wyoming doesn't necessarily need to go from 18 ventilators to 100. But there needs to be a central repository where ventilators are being constructed where you can surge, that if there's an outbreak in a region, and ventilators are needed, that you can get them there, and you can get them there in real time where the need is.
You know, some conservatives have asked about this. They say, is this a government overreach? Is the invocation of, for instance, the Defense Production Act something that is unprecedented? But it is worth noting, this law has been invoked many, many times over the years. It was invoked during the Obama administration. So while there might be concerns about how the government is handling this, on this particular front, it seems sort of like a no-brainer.
Well, and it's also how America has overcome virtually every major challenge we've seen, is the incredible economic might of the American free enterprise system. I mean, it's how we won World War II, as we directed. Remember, World War II for us started with Pearl Harbor, started with a kamikaze attack, a surprise attack that took out a vast percentage of our naval fleet, and we leaned in and rebuilt, and it was the power of this economy that enabled us to win World War II. We can mobilize that same economic power to make sure. You know, it was a striking thing, John. I don't know if you watched any of the debate between Bernie and Joe Biden.
Yes, it was painful, but I did.
I only endured about 30 minutes of it. There really was just sort of.
Well, there were no sports on Sunday night. You know, the NBA was shut down. So,
but it was very interesting when Bernie was pointing to this crisis as justification for socialized medicine and what he calls Medicare for all. I thought it was striking that Biden jumped in and said, well, you know, Bernie, Italy has socialized medicine, and we're seeing that it isn't working there. I mean, that in a Democratic primary was this sort of startling moment of sanity that stood out for how different it was from almost everything else in the primaries.
And even the Washington Post, not known for being a conservative voice, had the challenges of coronavirus to countries with socialized medicine. And the statistics that I just gave you about respirators and ventilators, Michael, the breathing machines that cost $50,000 a piece, that's where all the statistics come to, as to how few they have other places compared to the United States, and why, according to Johns Hopkins University, the United States is the most prepared country in the world to deal with this threat that we're facing.
Now, you described the U.S. versus England, and you said we're much better prepared than England. They have socialized medicine in England, too.
Yes.
How does the U.S. and England, how do they compare to Italy?
Well, both are better than what's happening in Italy now. The virus, it's unusual with this virus. We're seeing that it seems to be affecting not just older people who are smokers. And there's a question of, has the virus changed and mutated a bit in ways that it's striking people differently? You know, you look at China, they're kind of over the hump, it looks like, in terms of new cases. If you believe them, I don't believe them. And at the same time, you're seeing significant increases in France. They had a big jump in deaths the other day. So is it actually getting worse in Europe as it's getting better in China?
You know, Michael, John and I are both members of two informal caucuses, I would call them, in the Senate. One is the Boot Caucus, and there are probably 20, 25 senators that wear cowboy boots, Republicans and Democrats. And I've joked that if you're wearing boots, you can't be all bad. Sometimes our colleagues test that proposition. Yes. And then secondly, we are both among the senators of Italian-American heritage. So as we look at what's happening in Italy, John's ancestors and my own trace their lineage there.
I'm sorry, I have to say I'm not in the Boot Caucus, but I am in the Italian Caucus. And of course, that with a name like Cruz, I wasn't so sure about the Italian, but I'm certainly would.
Cuban, Irish, and just a little bit Italian.
That is excellent. And Senator
we claim
Barrasso,
him.
With
we
a more
claim him and are
Italian
happy
name.
to have him.
But I'm sorry, I cut you off, as you were saying.
No, I mean, it's Ted's right, and we talk about socialized medicine, and they're always stretched to the limits. So they really cannot handle the sort of things that are happening here globally. The stretch is even greater, and it's certainly this time of year. British hospitals are always overloaded at this time of year, and they have to cancel elective cases. And we are now in the United States canceling elective cases just to make sure the capacity is there. And a lot of it has to do with these personal protective equipment that folks need, in terms of the masks, in terms of the sterile gowns, the gloves, all of those things. Because if if there's not enough of them, then they shouldn't be using them for elective procedures.
Well, Senators, I would be interested in, Senator Barrasso, your medical perspective, and then Senator Cruz and your political perspective as well, on what the state lockdowns mean. A lot of people have written in and they understand that we have a federal system, and so the states can do things that the federal government cannot do. But as a conservative and as someone with absolutely no medical expertise whatsoever, how should I be looking at the state lockdowns? Are they a good thing? Are they conservative? Are they medically necessary?
Well, I'm a states' rights guy. I mean, that's how I was in the Wyoming state legislature. I am still that way now. And it's the governor of our state that's making decisions. And in many states, the governor can't even close down the schools. In our state, it's a local decision by various school boards, local control, local decisions. So I think it's better to have things done that way. Education is so much a part of this. But the more we can do to have people washing more frequently, staying in terms of the away from each other, the distancing, all of those things, I think is the better chance to take care of the first crisis, which is the medical crisis that we have, and then deal with the economic crisis that we also have. We just alluded a bit to the economic crisis and this strong and robust economy that we started from, and having to get that all restored again. To get to that point, we have to get the medical crisis behind us, and the best way to do it is the social distancing, the proper hygiene, and all of the things that we can do to stop the spread of the disease.
John, let me ask you, as you know, yesterday, Gavin Newsom, governor of California, said that over half of the people in California, over 25 million people, could become infected with this virus. As a doctor, does that sound credible to you? I hear a lot of people that are not sure the magnitude of the threat. What's your assessment from a medical perspective?
And Angela Merkel said in Germany, maybe 60 to 70% of the population there. If this continues to spread, and I think there's a difference between having the disease and testing positive, or having the virus.
What's the difference?
I think there are some people that may become infected and not even show symptoms or show signs of it. We've seen it with the younger people, with the children that may be carriers of the disease, that they would test positive. Then you worry about them near grandmom or grandpop. So they could have the virus in the system, and they can, but not really be affected by it. We're not exactly sure why that is. And when I talked about the possibility of a virus mutation and changes, now they're seeing in Europe sometimes, 45 or 50% of the people hospitalized are under the age of 55. I mean, we kind of thought of it as an old person's disease. And in terms of those dying, it does seem to be that older group. But some of the people on respirators are now in a somewhat younger group as well.
Now, are they mostly people who have asthma or other significant respiratory illnesses, or what?
I think they're still trying to figure that one out, because the medical systems in Italy and France are overwhelmed. They're not that able at this point to kind of come back with good research numbers and tell us.
And their fatality rates go up. I mean, when the medical system's overwhelmed, you see 4, 5, 6% fatality instead of 1 or 2%.
1 to 2%, which is what they expected it to be. The flu, which I think this year in the United States is going to kill about 36,000 Americans, that's 1/10 of 1%. Dr. Fauci said, if we get everything and do it right here, it would be 10 times that. But you're right. Across the world, we're seeing numbers much higher than that.
Well, Senator Barrasso, to your point, there may be many people who have the virus or who are not showing symptoms, or certainly who have not tested positive. Is there any way that testing will become so widely available that we'll be able to figure out what the denominator is? Because obviously we're not going to get a very good sense of the fatality rate if we don't know how many people have it in the first place.
Well, that's exactly right. And Ted and I were to lunch with the president last week, and Tony Fauci and others. And when they said, well, we're going to have more and more tests available, I said, well, then you're going to have a lot more positives just because they're already positive. They just don't know it. And we're now at that phase where I think we're over 17,000 positive tests in the United States. Over 200 have died. But if you could get to the point where more and more people are tested, we may know that denominator as well as the numerator. And I think it would be more helpful to see.
Well, I know that both of you are going to be in town to vote on this next part of relief for coronavirus. Already we've seen some announcements from the White House today, closing the border with Mexico, closing the border with Canada, putting off student loan payments for 60 days. I mean, there have been a number of provisions that have already come out. What can we look forward to as you guys are quarantined in Washington to see voted on over the next few days, and how will it help?
So I think we'll probably vote on Monday. Right now, where we are is that Mitch McConnell has filed a bill, and right now there is active negotiation with the Democrats. I don't know what's going to come out of that negotiation. As I look at the bill, I think it is important that we see strong action from Washington to provide economic relief. I'm very concerned that we are going to see in coming weeks millions and millions of job losses. Yesterday, I predicted over 1 million job losses. The numbers I'm seeing now are even 2 and 3 million coming up in just a week or two. I mean, there are a lot of layoffs. There are a lot of people hurting. There are a lot of small businesses. There are a lot of restaurants and bars and hotels that are just really hurting. The bill right now that has been introduced has really 2 important components to it. One is the individual relief, and that's basically sending a $1,200 check to just about everybody who makes less than $99,000 a year. That's individual relief, just to provide a check and some help. The second component is focused on loans for all of the small businesses, for all of the big businesses that are, the airlines are losing billions. It's focused on loans to help those businesses survive so people have a job to come back to. So that if you're a waiter, you work at a restaurant and your restaurant is shut down right now, you sure do hope that when you can go back, that restaurant hasn't gone out of business. And so, my view, look, I'm worried about what the Democrats are going to insist upon, and it is possible this bill gets to be such a mess that I vote no. I mean, if they put a bunch of garbage in there, that's possible. I will say I would characterize myself as pleasantly surprised as a conservative about where the bill is right now, in that it is not like the Obama stimulus. We talked last night about how TARP, for example, was very different because there you had financial firms whose own misconduct had caused much of the crisis.
Right.
This is different. This is more like a natural disaster, more like a hurricane or a fire, where it's not the fault of the restaurant that's shut down right now that this is happening. I'm glad that it's structured as loans. I think loans are the right way to do it, but it is still very fluid and up in the air. I mean, what do you think, John?
Yeah, I agree with you. I voted against TARP, and I'm happy with that vote. The small business component of this piece, I think, is very important because it's a loan, but any money that's used to keep the payroll going out to the workers, any money that's used to just keep the rent paid and the electric bills paid would be a forgiven loan. Now, if they wanted to use it for other things, that's different. So then they'd have to pay back with interest, but it would basically be a forgiven loan if it's used just so that the doors can open 3 weeks from now or whenever those businesses have come. And that'll be done through the Small Business Administration. 70% of the jobs in Wyoming, 70% of jobs nationally are through small businesses, less than 500 employees. In Wyoming, it's almost 95% of the jobs through small businesses. So we want to make sure that the small businesses can reopen once we get the medical component of this behind us.
Michael, one thing about John, he was one of the first senators I got to know, and the reason is that he and I flew together when I was just brand new elected in 2013. We flew together to Israel and Afghanistan, and one of the things really amazing about John is he's got a real heart for our troops and for our soldiers and sailors and airmen and Marines. And he travels all over the world. How many trips have you taken abroad to visit our troops?
Well, I go every Thanksgiving, no matter where our Wyoming National Guard are. I go every Thanksgiving. And this past Thanksgiving, talked to President Trump and said, "You haven't been to Afghanistan? Love for you to go." Our Wyoming National Guard is there. And we went in Air Force One. He surprised the world, certainly surprised the press, and surprised the troops. And it was really a wonderful reception by the president, by the troops on the ground in Afghanistan. But you're right, every Thanksgiving, wherever they are, I'm with our Wyoming National Guard.
Wow, that's tremendous. Yeah, and it certainly did surprise the press. I think they all thought he was playing golf, and it was quite a nice reveal for them.
Well, yeah, I forget there was one reporter had to do a big correction. I forget which network had blasted him for playing golf, and I think he was literally in the air at the time.
He was. Well, he was delighted that the surprise worked. He wanted to be. It worked. There were a lot of backstories, but the president.
Well, and you have to do it that way.
Oh,
When we went, I think it was 4 or 5 of us that went, and on that trip in Afghanistan, I mean, I still remember. Look, I'd been sworn into the Senate 3 days earlier, so I'm sort of brand new to all of this. And I still remember they're putting, flak jackets on us, and we're in helicopters flying over active war zones and getting instruction about, all right, if they open fire on the chopper, here's what you got to do. And look, obviously, when the president is coming in, you see Air Force One coming in, that has to be done at a high level of secrecy, because there are a lot of bad guys who would love to take a shot at the plane of the president.
And at night, and the windows closed, and lights off, and only lights were on the runway so they could see and land. But it was very impressively done. And then they kind of a lockdown on communications on the ground until we were on the plane getting ready to go, and then they lifted the restrictions so that everyone could send their pictures
Are you
back.
saying, John, that someone actually managed to stop the president from tweeting?
Well, that was part of
impossible. I don't believe that.
Well, no, well, someone was taking the role of the president as tweeter and continued to tweet during the trip so that the press wouldn't be suspicious or the public wouldn't be suspicious.
That's cool.
So, yes, his own phone
that job?
His own phone was taken away from him for the that part of the trip. It was it was terrific. And the best part for me coming back, my daughter, who had gone deer hunting that day, Thanksgiving in Wyoming, shot this beautiful buck, and she had texted me. I showed the picture to the president, and we called her on the phone, and she said, "Yes, Mr. President." Oh, it was the call of her lifetime to talk to the president as he's looking this picture of my daughter Hadley with the gun, with the buck, with an incredible rack on the buck. It was something.
That sounds much more exciting than my Thanksgiving. We have just about a moment left here, or a minute left, rather. I do want to get to one mailbag question. This is from Roger. Roger asks, why was the CDC and the government so ill-prepared for this situation? I know the system was obsolete, but what could have been done in years prior to be better prepared?
Well, look, I think there are a couple of things. Government bureaucracies are almost always inherently slow, and they've got a bunch of regulatory barriers. So when it came to the CDC, you look at the rollout of the tests. The rollout of the tests, as everyone knows, did not go very well. And a big part of the reason why is the CDC tried to do it all itself. They tried to do it within the federal government, and they had a problem with contamination in the lab, so the first test that came out didn't work. What we've done since then, and it's been a big shift, is that we've empowered the private sector. We've empowered labs like the Mayo Clinic and the Cleveland Clinic to develop tests. And I think they're good lessons learned. But look, that's not the first time a government bureaucracy acted like a government bureaucracy. It's not the last time that's going to happen.
Right.
But the more, and by the way, also on the FDA side, removing the barriers, we need to develop a vaccine. We need to develop treatments for coronavirus. We need to develop a cure. And there are a lot of wonderful professionals at CDC, FDA, and they're doing heroic work right now. But the FDA, they like their rules, and they're hesitant. They're resistant to change. And we don't need a vaccine 2 years from now. We need a vaccine fast, implemented, because we need to get out of this economic slowdown and get the economy back booming. We need to save people's lives. I mean, what do you think, John?
I agree completely. I think the CDC had this kind of command and control, centralization of everything, including the tests. And I think it didn't do as well as I would have liked. And I think the private sector is responding in a way that we know the private sector always responds. And that's why we have made the advances in the availability of tests. That's why we were behind at the beginning.
Well, that is a hopeful note to end on. We will have to leave it there. I know that both of you will have to go back because soon there will be a vote on the next stage of relief from coronavirus. Senator Barrasso, thank you so much for joining us. And
Thank
Senator
you, Michael.
Cruz, of course, thank you as always for shedding some light on what's going on, because there is a real problem in the flow of information here. So it's really nice to be able to see what the government is doing. We will be back with a whole lot more, but we can't do that today. So in the meantime, I'm Michael Knowles. This is Verdict with Ted Cruz.